Welcome to the quick guide for Novopen Echo. Do not use Novopen Echo without proper training from your doctor or nurse. Always read the instructions carefully before using Novopen Echo for the first time. Novopen Echo is an insulin pen with a dose memory function. The pen is available in red and blue. If you use two types of insulin, it is highly recommended that you use a different coloured pen for each type of insulin. Do not share your Novopen Echo or pen fill cartridges with other patients. Sharing the pen can result in the spread of infections from one patient to another, even if the needle is changed. Novopen Echo is designed to be used with pen fill cartridge 3 ml and Novofine Plus, Novofine or Novotwist needles. To prepare Novopen Echo with a new pen fill cartridge 3 ml, first pull off the pen cap and twist the pen apart. If the piston rod is sticking out, push it all the way back in. Check the name and colour of the cartridge to make sure that it contains the type of insulin you need, and check that it has no cracks or damage. Insert the cartridge into the cartridge holder with the threaded end first. Push the pen back together and twist until you hear or feel a click. If you use cloudy-looking insulin, also called white insulin suspension, always resuspend it before injection. The leaflet that comes with a pen fill cartridge 3 ml will show how to resuspend the type of insulin you use. If the pen fill cartridge 3 ml is already in use, resuspend it in the pen. There are different ways to resuspend white and cloudy insulin depending on the type of insulin. Resuspension includes one or both of the following two actions. Hold the pen horizontally between your palms and roll it back and forth. Move the pen up and down. Repeat until the insulin is uniformly white and cloudy. Right before injection, always attach a new needle. This reduces the risk of blocked needles, contamination, infection, and inaccurate dosing. If using Novofine Plus, screw the needle straight and tightly onto the pen. Always test the insulin flow before you inject. This makes sure that any gap and air bubbles are removed and that insulin is getting through the needle. If you do not test the insulin flow, you may get too little insulin or no insulin at all. To test the insulin flow, pull out the dose button and turn it to select 2 units. Press the dose button all the way in until the dose counter shows 0. And make sure insulin squirts from the tip of the needle. Repeat this procedure if insulin does not appear. The insulin flow test is complete when you see insulin squirt from the needle tip. A drop at the needle tip is not enough. To select a dose, pull out the dose button and turn it to select the number of units you need to inject. Adjust the dose by dialing forward or backward if necessary. Novopen Echo allows you to select doses in half-unit increments, starting at 0.5 and going up to a maximum dose of 30 units. Half units are indicated by lines between the figures. To inject the dose, lift a skin fold, insert the needle into your skin, and press the dose button all the way in until the dose counter shows 0. You may then hear or feel a click. Keep the needle in your skin after the dose counter has returned to 0 and count slowly to 6. Wait and count slowly. 1, 2, 3, 4, 5, 6. Always remove and throw away the needle after every injection. This reduces the risk of blocked needles, contamination, infection, and inaccurate dosing. Lead the needle tip into the outer needle cap on a flat surface without touching the needle. Once the needle is covered, carefully push the outer needle cap completely on. Always hold the black cartridge holder when you unscrew the needle, otherwise you may twist your pen apart. If this happens, twist the pen together again. Dispose of the needle carefully. Put the pen cap back on and store Novopen Echo according to the storage instructions in the pen fill cartridge leaflet that comes with a pen fill cartridge package. Novopen Echo has a dose memory that shows the number of units last injected and how many hours have passed since the last injection, up to 12 hours. To activate the dose memory, first pull out the dose button. Then push it back in. After a brief display check, the display will now show how many units were last injected and how many hours have passed since that injection. The number in the middle of the display represents the amount of units last injected. The 4 tick marks are always visible when the display is activated. Each segment around the edge represents 1 full hour that has passed since the last injection. In this example, 5.5 units were injected more than 3 hours ago, but less than 4. In the following, we will show you 3 examples of display readings. This is an example of 5.5 units injected 12 or more hours ago. This is an example of 5.5 units injected more than 1 hour ago, but less than 2. And this is an example of 5.5 units injected less than 1 hour ago. When the pen fill cartridge 3 ml is empty, replace it by first twisting the pen apart. Then remove the pen fill cartridge 3 ml and insert a new one. If you need more insulin than the amount left in the pen fill cartridge 3 ml, take your full dose from a new cartridge. Only if trained or advised by your doctor or nurse, you may split your dose between 2 cartridges. If you become distracted, make a miscalculation, or forget to test the flow, you may get a single under- or overdose, which may lead to too high or too low blood sugar levels. Thank you for watching the quick guide for Novopen Echo.